I'm Kylie Harris, and I decided to do my final presentation on the importance of flexibility. The first thing I wanted to talk about was the benefits of stretching and flexibility. Flexibility is the ability of a joint or joints to move through a full range of motion, and some of the benefits of being flexible are increase of blood flow, enhancing of the joint flexibility and function, decrease of joint pain, lower stress hormones, and the reduce of lower back pain. Next, we have the 4 types of stretching, starting with ballistic. The oldest technique is the ballistic stretch, which makes use of repetitive bouncing movements. It has been virtually abandoned by most experts in the field due to safety concerns. The next one is dynamic stretching. Dynamic stretching incorporates movements that mimic a specific sport or exercise in an exaggerated yet controlled manner, and it often includes during the warm-up or in preparation for a sports event. Next, we have static stretching. The static technique involves passively stretching a muscle to the point of mild discomfort by holding it in a maximal stretch for an extended period. It remains a very effective, relatively safe, and popular method of stretching. Recommendations for the optimal holding time are varied, ranging from 10 seconds to 60 seconds. Last, we have PNF stretching. PNF techniques involve a partner actively stretching the participant by some combination of altering contraction and relaxation of both agonist and antagonist muscles. Next, I'll talk about what determines flexibility. Structurally, it is limited by joint structures and muscles and tendons that cross joints, and also it is affected by the nervous system. Other factors that affect flexibility are genetics, gender, age, body type, and activity level. When assessing flexibility, we are looking at joint-specific range of motion tests that evaluate whether your joints are more or less flexible than average. Some examples are the calf muscle flexibility test, which is where you see how far you can pull your leg back from the wall while still touching your knee to the wall. And then there's the sit and reach test. A study was performed involving female university students where they tested 3 different forms of the sit and reach test. They used the traditional sit and reach test, the chair sit and reach test, and the back saver sit and reach test. The results indicated that the back saver sit and reach test produces reasonable, accurate, and stable measures of hamstring flexibility. Moreover, it appears that this test is a safe and acceptable alternative to the traditional and chair sit and reach tests as a measure of hamstring flexibility in young women. Some tips on avoiding stretch-related injuries are increase muscle temperature via passive or active heat before stretching. Hold stretches for 10 seconds or more to allow receptors to make nervous system adjustments, and also consider personal limitations and health issues.